Hi, I'm Dr. Deepa. I'm an orthodontist at Oasis Dental Care, Chennai. Today we are discussing about the basic facts of dental implant. What is a dental implant and why do we need a dental implant for replacing a missing tooth? So if you are looking at the natural tooth, the root is anchored to the jawbone. So every time if we bite and chew our food, that natural tooth will transmit the forces to the jawbone and the jawbone will get stimulated. And if we remove a tooth, that stimulation won't happen. That force won't, there is no root to transmit the forces to the jawbone and the stimulation won't happen. So that area, the bone will shrink. The same thing happens on our other skeletal system also. If, for example, if you ever had broken your arm and you worn a plaster cast for a period of 6 weeks and you are not using that arm for a particular period, you will know that bone and muscle in that arm will shrink, and after 6 weeks that size will be little bit smaller compared to the other arm. The same thing happens in our jawbone also. If we remove the teeth, there is no natural teeth to transmit the forces, and so that the jawbone will shrink in particular area. So only thing to avoid this shrinkage of the jawbone is to replace it with a artificial root that is known as dental implants. Now we will discuss the difference between the bridge treatment and implant treatment. If you are missing tooth, we have two options. One is the bridge treatment, other is the implant treatment. And for bridge treatment, we'll chop the adjacent natural teeth and make it in a small nub, and 3-unit crown we'll place together. That is the bridge treatment. An implant will place single implant itself. Most of the patient will prefer bridge treatment because of the cost issues with the implant. For implant treatment, it will cost around 25 to 30K. I'm telling the average value. It may vary, depends on the quality of the implants and all. For a 3-unit bridge treatment, the cost will come around 12K. That is 4K per teeth. 3 into 4, that is 12K for average crown. I'm telling the average value only. Based on the crown also, it will vary. So it is 12K and the implant is 25K. So patient will opt the bridge treatment. But I'll tell the issue regarding the bridge treatment. If you are going for the bridge treatment, there's a cleaning difficulty will be there. And so that because of the cleaning difficulty, that adjacent tooth may get decay. And in future you may need root canal treatment, or you need to remove the teeth, and then that time the 3-unit bridge will become 5-unit or 6-unit bridge. It will around 10-15 years only that bridge warranty will be there. After that some issue may happen. So at that time you have to pay 5-unit or 6-unit bridge, you have to pay. So if you are going for a 7-unit bridge after 10 years, you just imagine the price over that time. Now it is 4K. At that time it may be 7K, 6K, 7K. So it may comes around 42K like that only. So if you are not spending this amount right now, you will spend the double amount later. That is the difference between the implant and bridge treatment. And if you are going for an implant, the initial amount is little bit on higher side only, but you will be getting advantages. That is, first one is you are getting a lifetime warranty. And second one is that you are replacing the root with an artificial implant, and the force is transmitted to the jawbone and jawbone is getting stimulated. So there will be no bone loss at all in that particular area. So you are getting advantages of having an implant. So you should definitely go for the implant treatment rather than bridge treatment.